You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please kick us off.
Hey, I'm Ivan Zach. I'm really excited today about our guest. This is a colleague and a very well-known figure in the veterinary domain, Dr. Neil Shaw. Dr. Shaw was born in South Africa and grew up in his father's small animal practice in Tampa, Florida. A graduate of University of Florida, Dr. Shaw remained in Gainesville for the internship and residency in small animal internal medicine, going to become a diplomat of the ACVIM. He went on to found the nation's largest group of specialty hospitals, Blue Pearl Veterinary Partners, and he served as the first chief medical officer for the Mars Inc. Veterinary Health Group. Since then, Neil found SignalPET in 2018, an independent company dedicated to bring the benefits of advanced artificial intelligence diagnostics to veterinary practitioners in any location. Neil, this is a pleasure to have you here. Very excited for this conversation. Thank you for finding the time.
I appreciate it. Good afternoon, everybody. For those in the middle of America on the East Coast, but thanks for having me. Yeah.
So SignalPET, for just lazy maybe that don't know what it is, but can you give us a brief sort of what is the value proposition? What are you doing, and how are you changing the world?
Sure. The SignalPET provides instant radiographic interpretations for veterinarians in practice. A veterinarian will take radiographs. Those radiographs will be uploaded to our systems automatically, and within minutes, a review of the most common findings, yes or no, will be available for the veterinarian, even prior to speaking to their pet owner, prior to speaking to the client. It's
That's awesome.
It works very well. Yeah.
Yeah, it's so funny, Neil. We've had your co-founder on the show before, and a lot of people don't know this, but one of the first times Ivan, you and me spent time together was at a Google conference where they talked about AI and radiographic technology in the human medicine everywhere is except for the US and Canada. And, that was 5, 6 years ago. I was at the founding of my company. What's changed since then? And specifically, what's happened in veterinary medicine? You guys, I think, were the first to do this in a very serious way. So you has to be a lot of change since you started. So kind of give us a current state of the union.
It's happy to. Happy to. What's changed is several things. One is the need for what we do has grown significantly. So we first went to the market. Oh gosh, it was early 2020, and here we are 4 years later. And currently, we read for pretty much 10% of the industry. We read all their films for roughly 10% of the industry, and expect that to progressively increase significantly as we go along. So the acceptance of what we do has dramatically increased. The specificity of our findings, the range of what we look for, and the range of our findings have increased. And I think from a profession standpoint, the acceptance of AI in the profession has increased significantly just in the last 4 years. It's actually been dramatic. Yeah.
Yeah, it's interesting how right now, in the last, I should say like half a year to 9 months, my usage of, different artificial intelligence tools increased and everything that's coming out. But what I'm more exposed into these large language models and Chat GPT and platforms like that, and then Shawn is very close to that world. Appearance of those platforms, was there something revolutionary changing now in the radiographic interpretation in your world in parallel to what the main kind of media noise over Chat GPT and an OpenAI and all of that stuff? Is there something on your side of the world, or is it disconnected things? Or
it's a great, Ivan. It's a great question. Very much connected. Two things I think have happened agreed in the last year. One is with AI being more and more in the news, ChatGPT and related products or services. We have gone from AI shouldn't be used in veterinary medicine to AI can't be used in veterinary medicine to which AI are you using? And it's happened that quickly. It has really happened that quickly. Two, there's a recognition that AI, the presumption was that AI is just AI, it's all the same. And now folks are realizing that there are differences. There are differences in approach, there are differences in methodologies, there are difference in outcomes based on the above. And folks are beginning to look at it, folks being colleagues, when I say folks, I mean colleagues, look at it more carefully and say, gosh, this is real. What works for me? Yeah.
So I think that's a great jumping off point to my question, which is, you know, there's a lot of talk about GPT-5 coming at us this summer. It's rumors at this point, but what impact do these advancements in large language models, as we inch towards maybe the singularity, maybe something different, what impacts do you guys perceive them to have? Because I guess that's all we can do at this point on the work that SignalPET does today. And how does that advance the industry of radiographic readings? And then let's jump on a spicy question. What does, organizations like ACVR or the broader radiology community in veterinary medicine, what are you hearing from them in regards to the work that you guys are doing?
Several questions there. Great questions. As specifically as you said, as ChatGPT develops, as AI becomes more sophisticated, no doubt we are adapting to that. One of the things that we have done is take our initial standard product, which is called Signal Ray, gives a reading interpretation of the film agnostic to history, agnostic to signalment. We determine the signalment ourselves, the breed, the sex, the age, and agnostic to clinical history. The utilizing large language models, utilizing new, more sophisticated AI, we can actually perform a full consult. And so now we've moved from just introduced this year, from doing a yes, no, what's on the film, to actually developing a full consultation where a clinician can ask a question, provide a history, and in combination, looking at the X-ray findings, determine appropriate conclusions, appropriate clinical recommendations. We have those reviewed by specialists and then released back to the clinician. And we can do that in a fashion where, because we use technology, and although we have specialist oversight, we can produce it at a much lower cost than is traditional. We can produce it at an exceptionally high quality, and we can do it at a scale. Yeah. So it's I appreciate that question. I think where's the pushback? The pushback is expected. The pushback is expected from those who have had very tight control of a market and want to maintain tight control of the market. At the end of the day, we believe clinicians have the confidence to choose for themselves and should not be told what they should choose and what should not choose. And so we put the trust in clinicians choosing for themselves.
So that opens up a very interesting topic on how do the clinicians use it. So we in urgent care. So I'm building urgent cares now, and and we decided to supplement what we do with SignalPET. We just started using it, and the speed with which you actually give interpretation is really fast, because I'm not in GP. I can't wait for next day interpretation, and I can't afford your competitors for stat, because it just becomes not affordable to the pet owner. So it became really, really helpful. But what do you hear from the field? Is it, so you have two components, because you do have a radiographic interpretation, but then there's an AI component, which I really like, which allows us on the floor is sort of to dabble in it, not necessarily fully dive in and say, let's trust AI, but kind of test the waters and see, okay, well, that's what it is. And then let's escalate to radiologists and then check back with it and say, okay, well, that was helpful. Because honestly, we tried your competitor, not going to name who it is, but then we had clearly linear foreign body dog that your competitor found a rib fracture on. which was not existing and
Right.
didn't tell us about the linear foreign body. So that was not
Mm-hmm.
helpful. That made us pause a little bit on using AI in general. We were just a little shy. But how do you feel people use? Did you find that it's really helpful that there is a sort of AI and then there's a radiologist? And how did you make it so scalable and affordable?
Yeah, great points. We do a lot of straight interpretations, pattern, which are AI, which are pattern recognition, linear foreign body, cardiomegaly, left atrial enlargement, chordodorsal infiltrate of the lungs, suggestive of congestive heart failure, and such, stifle effusion. The pattern recognition the AI is excellent at. Consultations are more complex, but again, with more sophisticated systems, you can actually handle complex data sets, and you can have exceptional quality results with these newer systems available today. The fact that we can get the basic answer through our systems returned very quickly, we can then utilize radiologists, but I'll say radiologists and other specialists as well. And there's a significant reason to use other specialists in addition to radiologists is because other specialists provide a lot of significant input. If you have a stifle effusion, it's really nice to have a surgical opinion on that. If you have hepatomegaly, it's really nice to have an internist give an opinion on that. And the fact that we can deliver to the specialists such complete information and they can review and then, if you will, fine tune the information from there makes it scalable. And we found that our colleagues, our specialty colleagues in practice, radiologists and other specialists, are very happy to do that. And so we're able to provide it 724 for that reason. And to me, this is the new model moving forward because the the quality is exceptionally high, and the price point actually is brought down significantly from where we are today. Yeah.
Neil, what's the future look like? So here we are today, all of these new technologies popping up around us. OpenAI is doing incredible stuff. Google's playing catch up. All kinds of things are happening in the market. But you speak and you've spoke a lot about this concept of human in the loop. And it's something that I'm very familiar with. We do the same thing at Talkatoo.
Hmm.
We have a product, one of our many products that puts a human in the loop, make sure the AI doesn't make any mistakes. How long before the human is out of the loop or
It
less in the loop?
it will happen over time. Agree. To answer, at what point will a human be out of the loop? And the answer is when the quality control can be as high, if not higher. So everything, all decisions that we make and they should be made about QC. It's all about quality control. It's all about systems of quality control. And as the quality control is the same as if a human would loop or higher, and that can be demonstrated again and again and again, then yes, that potential exists. When exactly will that happen? It's hard to say, but
Yeah, it's so
it's
fascinating,
likely.
and
Yeah.
it it's fascinating, and it kind of dovetails back to my poking the bear a little minute ago with the radiologists and the College of Radiology, which is one of the things that I used to talk about a lot. I had an IT services company. We sold cloud solutions before it was called the cloud, and everybody was wondering what the technicians were going to do that managed the servers when everything moved to the cloud. And we said, don't worry about it. There's all kinds of other work. There's all kinds of other work for these people that's meaningful, or maybe even more meaningful or more impactful to the business. In your opinion, what does the future, and I realize, and our audience will realize too, that's an opinion, but what does the future of the radiologist look like, given this technology is so quick and able to perform at such crazy scale?
Yeah, no, great question. Twofold. One, let's acknowledge that the current radiology services provided by radiologists uh, doesn't meet the need of clinicians and patients, right? In other words, there are more films to be read today than there are radiologists available to read them. And that's a very safe statement. And in fact, a very small minority, a very small percentage of films are actually reviewed by radiologists. And we believe that majority, if not all films taken should be reviewed and should be reviewed in an economic fashion. So currently the need is there, even if nothing happens with changes for the radiologist. In addition to that, I don't think we could pick a veterinary school, a specialty practice, or a large practice that wouldn't raise their hand and say, yeah, I could use a radiologist in-house. I think there is a tremendous radiologists are exceptionally good at image recognition. And I think, and then they have a skill set in ultrasound, a skill set in cross-sectional imaging, CT and MR, and such that there's lots to do. I don't think as a radiologist, from that perspective, I would not be concerned. Yeah.
Well, it's the same thing as we use hemocytometer to determine the blood cell count.
Right.
But all of a sudden now machines are doing it, and nobody is remembering, why are we not doing it manually with the technicians? And there's all of these things that the certain profession. I'm not saying that radiologists will go away, but as you said, with the shortage of radiologists, it's those things that machine cannot do, they will continue doing. And if we do have a true shortage of, right now, I think IDEX Hires, when I was there, I think they were trying to sponsor. I think they do have a program where they sponsor veterinarians going to radiology residency, hoping that they will work for them. So that's like a 4 year
Right.
investment in advance to put them to read radiographs. So that model could be improved so much with this. And it's just, it's very exciting, because some of these things, some of these questions that we can ask and say, what do you think the 5 years look like, 5 years ahead? I don't know what the month ahead of look like. ChatGPT will come out, 5. We don't know what it's going to be in summer. So I'm excited that in my lifetime, we will see these changes and how every profession, including ours, will improve. And I do think that it will improve by, solving the shortage of veterinarians. The statistics floats around that by 2030, we'll need 41 more thousand veterinarians.
Wow.
So why can't we then scale everything that we do, redundant, slow, inefficient, dictation, Shawn is in that area, all of these things to facilitate and utilize to the maximum capacity the human resources that we have. So I think that's really how I look at it. But the 20 minutes run to the end. And this is always very quickly. Please tell us where people can find you and your creation, and how do they sign up? And then we'll go on to our 2 questions that we always ask.
I appreciate that. The website, it's very easy. So signalpet.com, very easy to sign up and get started. It's about a 20-minute onboarding session, and pretty much ready to go. So signalpet.com. Thank you. The one thing I would say, if I may, sorry, about the radiologist, and the thought occurred to me, and I want to make sure I get it across. I 100% wish them well, right? And the way to expand radiology is to open the market. It's not to constrain the market. That's the way for everybody to. Rising tide raises all ships, and open the market up. That's how radiology, and specifically radiologists, will progress. It's when you try to constrain a market, that's when either you get shut down or folks just go around you.
Yeah, it's fascinating. And I mean, there's a whole other conversation to be had. So maybe we'll do that sometime. But for right now, we got a couple of quick questions for you. One is a YouTube video, a TED Talk, a book, something that you found inspiring on this very interesting path that you've been on in your career.
I appreciate it. It's a book, but it's really an individual. My mentor at Florida, at the University of Florida, was Michael Shear. And Michael Shear is an internist, criticalist, one of the founders of the Critical Care College as well. I think of him often and his training, in that he has a tremendous depth of knowledge of clinical medicine, internal medicine, critical care, and at the same time, a very pragmatic approach. And he teaches his students and others not to be afraid of medicine, and that the patient ultimately will always tell you what's wrong. And so he has a book, Clinical Science in Small Animal Medicine. Again, depth of knowledge, very pragmatic, very straightforward. And I think really any material from, as we say, Uncle Mikey, is positive. And his book, I think most clinicians will enjoy. Yeah.
That's awesome. And the second question we always ask, who do you think would be a good guest on our podcast?
I would choose the president of the ACVR.
Interesting.
And Ryan, I think that would be a great. I think that would be a great guest. I think there'd be, if there's a counterpoint, I'd love for it to be presented formally. And actually, what I'd really enjoy is a joint discussion. If you guys might be open to that, because often things are said about us, and questions are raised, but those questions are never raised. My phone stays silent, and I would love to have the ability to engage in that conversation. I think that would be fantastic.
That's very interesting. I think it would be to set up a webinar and discussion and facilitate between you guys. It would be it might be a very interesting take on it.
That'd be super. And I think genuinely present strong points, areas of agreement and areas of disagreement. There's nothing wrong with that. Yeah.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.